This is a special global health broadcast on hantavirus surveillance and residential biohazard risks. Public health authorities are issuing urgent warnings as seasonal maintenance and spring cleaning activities expose unsuspecting property owners to dangerous pathogens. Recent reports from medical institutions and state agencies, including the New York State Department of Health and UC Health in Colorado, highlight a critical reality. Human environments are increasingly intersecting with wildlife vectors, turning everyday residential structures into silent biological hazard zones. The World Health Organization estimates that between 10,000 and over 100,000 hantavirus infections occur annually across the globe, with the largest collective disease burden currently localized in Europe and Asia. However, the Western Hemisphere faces an exceptionally lethal manifestation of the pathogen. While European and Asian strains typically cause hemorrhagic fever with renal syndrome, which primarily affects the kidneys and circulatory system, the strains native to the Americas induce hantavirus pulmonary syndrome, a rapidly progressive and devastating illness targeting the lungs and heart. Data from the World Health Organization indicates that hantavirus pulmonary syndrome carries a catastrophic case fatality rate of up to 50%. Public health officials emphasize that viewers must understand the underlying mechanics of transmission to protect their households. Hantaviruses are zoonotic agents belonging to the family Hantaviridae within the viral order Bunyavirales. Unlike typical domestic pathogens, this virus does not rely on active human-to-human transmission for local outbreaks. The sole known exception is the Andes virus in South America, where limited transmission has occurred via prolonged, close contact among household members. Instead, the global threat is maintained by specific wild rodent reservoirs. In the United States, the primary vector is the deer mouse, though white-footed mice, cotton rats, and rice rats also harbor distinct strains. The virus establishes long-term asymptomatic infections in these animals, meaning the rodents show no outward signs of illness while continuously shedding viable viral particles into human habitats. Turning to the core epidemiological developments, diagnostic criteria, and official agency tracking, medical experts warn that identifying hantavirus infections early is extraordinarily difficult. According to infectious disease specialists at Stony Brook Medicine, the initial symptoms mimic standard seasonal flu or common respiratory infections. Patients typically present with a fever, deep muscle aches concentrated in large groups like the thighs and lower back, fatigue, headaches, chills, and gastrointestinal distress such as vomiting and abdominal pain. These symptoms materialize anywhere from 1 to 8 weeks following an exposure event. Because there is no specific antiviral treatment or cure for hantavirus, clinical intervention relies entirely on early supportive medical care. Hospitals must initiate intensive clinical monitoring, utilizing advanced mechanical ventilation, cardiac support, and renal management to maximize survival outcomes. The urgency of this surveillance is highlighted by recent domestic and international events. Public health data confirms a hantavirus death this year in Douglas County, Colorado, involving an adult resident. While health officials clarify that this domestic fatality is completely unconnected to a concurrent international outbreak investigated on the MV Hondius cruise ship, it underscores how pervasive the domestic risk remains. Furthermore, epidemiological records show that geographical location drastically dictates risk profiles. The Centers for Disease Control and Prevention estimates that 94% of all hantavirus cases in the United States occur west of the Mississippi River. This distribution tracing dates back to the landmark 1993 outbreak in the Four Corners region of Arizona, Colorado, New Mexico, and Utah, where 53 individuals contracted hantavirus pulmonary syndrome, resulting in 32 deaths. Environmental scientists from the Los Alamos National Laboratory have provided a crucial breakthrough explaining this geographic disparity. Their research indicates that the drier air characteristic of the American West allows excreted viral particles to persist in the environment and easily aerosolize, whereas the higher humidity and precipitation in the eastern United States tend to wash the pathogens safely into storm drainage systems. Spillover events frequently occur in what ecological researchers call edge ecosystems, where rapid human development encroaches directly into wild animal habitats. This includes cabins, barns, grain silos, workshops, and infrequently used residential basements or attics. In response to these persistent biological threats, international health agencies and local departments have established standardized prevention protocols and strict guidelines for home remediation. Because hantavirus is primarily an airborne hazard, the most dangerous mistake a property owner can make is sweeping or vacuuming dry rodent droppings, urine, or nesting materials. Dr. Mara Jana Broadhurst, Director of the Infectious Diseases, Diagnostics, and Biopreparedness Council at the University of Nebraska Medical Center, warns that disturbing these dried materials causes microscopic viral particles to become immediately aerosolized, creating an invisible cloud of infectious dust that is easily drawn into the human respiratory tract. To eliminate this risk, public health guidelines mandate a strict wet disinfection methodology. Before entering any potentially infested or long-closed structure, such as a seasonal cabin or shed, operators must open all doors and windows to ventilate the space for at least 30 minutes. Staff and residents must don personal protective equipment, specifically rubber or plastic gloves and a well-fitted N95 or higher respirator mask. Instead of sweeping, the contaminated area must be thoroughly soaked with an Environmental Protection Agency registered disinfectant or a household bleach solution mixed at a ratio of 1.5 cups of bleach per gallon of water. The New York State Department of Health directs that the disinfectant must soak into the debris for a minimum of 5 to 10 minutes to fully inactivate the virus before it is wiped up using disposable paper towels. All waste materials, including traps and carcasses, must be double-bagged in plastic and placed in secured outdoor garbage receptacles. For long-term prevention, home containment requires structural exclusion. Property owners must seal every external gap or hole larger than a pencil diameter using durable materials like steel wool, caulk, or sheet metal. Food supplies and pet food must be locked in thick plastic, glass, or metal containers with airtight lids, and outdoor vegetation must be cleared back from foundations. Public health officials acknowledge that massive gaps in global knowledge remain. Researchers note that undiscovered hantavirus strains likely exist across underreported sectors of Africa, the Middle East, and the Indian subcontinent, leaving the true global baseline uncertain. For ongoing coverage of emerging global health security and epidemiological updates, subscribe to this news service. Turning to the core developments, agency updates, and clinical parameters of hantavirus tracking, public health institutions emphasize that early medical detection remains a formidable diagnostic challenge. Experts from Stony Brook Medicine state that the initial clinical manifestation of hantavirus infection is highly deceptive, frequently mimicking routine seasonal influenza or common respiratory conditions. Patients typically present with a suite of nonspecific symptoms, including sudden high fever, profound fatigue, chills, headaches, and intense muscle aches, concentrated in large muscle groups such as the thighs, hips, and lower back. As the disease progresses over a time frame of 1 to 8 weeks following exposure, individuals may experience secondary symptoms including dizziness, abdominal pain, nausea, and vomiting. In cases of American hantavirus pulmonary syndrome, the illness rapidly shifts from these flu-like signs into a critical phase characterized by sudden coughing and severe shortness of breath as the lungs fill with fluid. Because there are no specific antiviral medications, targeted cures, or vaccines approved for hantavirus, clinical management relies entirely on early identification and aggressive supportive care. Hospitals and intensive care units must deploy immediate interventions, which frequently include advanced mechanical ventilation and extracorporeal membrane oxygenation to support cardiopulmonary function while the patient's immune system fights the infection. The urgency of local surveillance has been punctuated by recent domestic fatalities reported by state health agencies. This year, public health officials with UC Health and local authorities confirmed a fatal case of hantavirus pulmonary syndrome in an adult resident of Douglas County, Colorado. Epidemiologists from the Colorado Department of Public Health and Environment verified that this domestic death was an isolated incident, entirely separate from an international maritime investigation involving cases on the cruise vessel MV Hondius. The geographic distribution of these domestic cases follows a strict and well-documented environmental pattern. Data maintained by the Centers for Disease Control and Prevention indicates that approximately 94% of all confirmed hantavirus cases in the United States occur west of the Mississippi River. This epidemiological tracking originates from the landmark 1993 outbreak in the Four Corners region, where Arizona, New Mexico, Colorado, and Utah intersect. That initial outbreak resulted in 53 confirmed infections and 32 deaths, leading to the formal identification of the sin nombre virus strain. Environmental scientists and researchers at the Los Alamos National Laboratory have established a definitive correlation between regional atmospheric conditions and viral persistence. Their findings indicate that the semi-arid, low-humidity climate of the American West allows excreted viral particles to remain stable and viable in dry dust for extended periods, facilitating rapid aerosolization when disturbed. Conversely, the higher ambient humidity and frequent precipitation patterns characteristic of the eastern United States cause viral particles to break down more rapidly or be washed into drainage systems before human contact can occur. Furthermore, environmental surveillance indicates that transmission risk spikes in specific structural settings, particularly rural properties, agricultural outbuildings, grain storage facilities, and seasonal cabins that have remained closed or unventilated for months. These structures act as artificial containment zones where wild rodent populations seek shelter, leaving behind concentrated biological deposits that pose an immediate risk to agricultural workers, property owners, and travelers entering the premises. Addressing the critical mandates of prevention, structural remediation, and global surveillance protocols, public health agencies emphasize that the mitigation of hantavirus risk relies entirely on eliminating exposure to aerosolized pathogens. Dr. Mara Jana Broadhurst, representing the Infectious Diseases, Diagnostics, and Biopreparedness Council at the University of Nebraska Medical Center, explicitly warns that the single most dangerous action a property owner can take is sweeping, vacuuming, or utilizing leaf blowers inside a suspected rodent-infested space. Because the virus is highly fragile when exposed to liquid but remarkably resilient when bound to dry organic material, disturbing dried droppings, urine, or nesting debris instantly launches microscopic viral particles into the breathing zone. This creates an invisible, highly infectious aerosol cloud that easily bypasses natural upper respiratory defenses. To prevent inhalation, official guidelines from the New York State Department of Health and the Centers for Disease Control and Prevention mandate a rigorous, wet method disinfection sequence for any environment showing signs of rodent activity. Before initiating cleanup operations in long-closed structures such as seasonal cabins, sheds, workshops, or crawl spaces, individuals must open all external doors and windows to cross-ventilate the area for a minimum of 30 minutes, allowing stagnant air to dissipate. Operators must wear appropriate personal protective equipment, including thick rubber, latex, or vinyl gloves, and a properly fitted N95 or higher particulate respirator mask. Instead of direct mechanical removal, the entire contaminated area, including individual droppings and nesting sites, must be thoroughly saturated with a commercial, Environmental Protection Agency registered viral disinfectant or a freshly prepared household bleach solution mixed at a concentration of 1.5 cups of liquid bleach per gallon of water. Public health protocols require that the wet solution remain undisturbed on the debris for 5 to 10 minutes to fully dissolve the viral envelope and inactivate the pathogen. Once deactivated, the material must be wiped up using disposable paper towels or rags, which must then be double-bagged in heavy plastic and placed directly into secure outdoor waste containers. For long-term risk reduction, public health officials stress structural exclusion. Property owners must systematically inspect foundations and exterior walls, sealing every gap, crack, or hole larger than 1/4 of an inch, roughly the diameter of a standard pencil, using durable, rodent-resistant materials like steel wool, concrete mortar, caulk, or metal flashing. Furthermore, households must eliminate attractants by storing human food, pet kibble, and livestock feed in heavy plastic, glass, or metal containers fitted with airtight, secure lids. Beyond individual property management, global health organizations highlight severe gaps in the international surveillance architecture. Epidemiologists acknowledge that substantial uncertainties remain regarding the true global baseline of hantavirus, as large geographic sectors across Africa, the Middle East, and the Indian subcontinent suffer from underreported diagnostic tracking and a lack of specialized laboratories, meaning entirely undiscovered strains may currently be circulating without official detection. Ethically, public health communication must maintain a careful balance, conveying the severe, high-fatality nature of hantavirus pulmonary syndrome to ensure strict compliance with cleanup safety rules while avoiding unnecessary panic, since the virus is completely preventable through deliberate, standard hygiene practices and does not sustain human-to-human transmission chains. For continuous updates on global infectious disease monitoring and health infrastructure news, subscribe to this broadcast channel.